Why are nursing students so scared whenever we are asked to go and give medications at the ward? At times, they are asked to go and calculate a medication to give to maybe the kids, and then they just feel so scared. They don't want to even go and do it. When you ask them, they are like, "Oh, then try to me, yeah." Others too are like, "Oh, we have been taught, but I don't want to do it because I don't know how to calculate the drugs." So don't worry. Today we are going to learn how to calculate medications at the ward, okay, especially for the pedics, because the pedics, their medications are some way that you have to calculate before you give to them. So I'm going to show you a step-by-step method of calculating drugs at the hospital, and do what to watch till the end. If you are a rotation nurse or becoming a rotation nurse very soon, and also a student nurse in school, even for our personal users as well at home, do well to watch till the end as well. If you don't know who I am, hi, I'm Mavis Akest. I'm a registered general nurse, and in today's episode, I'm going to teach you all how to calculate medications at the ward or in school. I also have a premium Telegram channel for my aspiring nurses, people who are interested to become nurses this year, where I'll be taking you through everything step by step in order for you to gain admission or know more things about nursing before even selecting the program you want to do in nursing school. So do well to DM me or comment, or I'll add a link in the bio and also the link in the description as well. So you can just feel free and WhatsApp me, okay? I would also be creating a Telegram channel for the level 100s in school and maybe 200. I just want to focus on those people first because I'm going to share my knowledge and what I was taught in school so that studies will become very easier for us. But it will be paid. So to join that group, it will be 50 cedis to join that group, okay, for a month. If you are interested, kindly let me know so that I create the channel for all of us, okay. First of all, in nursing, we were taught in school that before you administer a drug or give a medication to a child, you have to check the expiring date, the right medication, right dose, right time, right patient, and also the right route. Yeah, so with that one, I've already talked about it, that with the right time, the time is when the patient is going to be served the medication. You have to check whether the time is correct, and also the right patient, the patient's name. You have to confirm the patient's name before you give the medication to them. Right dosage. The dosage is what you're going to calculate today. So with the dosage example, we have 600 milligram of amoxiclav to give to a patient. But before you give to the patient, the doctor says that give the patient 270 milligram the amoxiclav. So how are you going to give the medication to the patient? We will talk about it in my next chapter. We also have right route. How are you going to give the medication to the patient? Is it by the oral route? Is it by intravenous? Is it by subcut? That one too is right route. And then right medication. Check that the medication you are giving to the patient is correct. If it is amoxiclav, you check amoxiclav. If it is Genta, you check it is Genta before you give the medication to the child or the adult. Let's talk about the dosage calculation because that is what we're going to talk about today. Okay, so in school, we were taught that giving the medication to the child or adult, the calculation is dosage required divided by the dosage available times quantity. Let me explain to you better for you to understand the meaning of the dosage available, dosage required, and also the quantity. When we say dosage required is what the doctor wants you to give to the patient. If the doctor says give 270 milligrams to the patient, that is the dosage required. Give 300 milligrams to the patient, that is the dosage required. So that is what the doctor wants you to give to the patient, unless you calculate it before you can administer. The next thing is dosage available. With the dosage available, it simply means if you buy a medication and then they've written 750 on it, that is the dosage available. The whole medication, without being diluted, the whole drug being given to you is the dosage available. And then when we say the quantity simply means that when you draw the medication into a syringe is the quantity. When you draw the medication from here to here is the quantity. So if you draw the medication from here and then it makes this syringe full, it simply means that this medication, the quantity is 10 mils. If let's say you draw the medication from the valve and then it makes this syringe maybe 2 mils, it simply means that the medication is just 2 mils. At times, the manufacturer who made the medication writes it at the side of the medication. For example, this medication, the manufacturer wrote that the medication is 750 of cefuroxime. If you add the water to it, like you mix it, when you transfer this whole medication to the syringe, it is 10 mils. If you transfer the whole medication to the syringe, the number you are getting is the quantity. So now let's calculate something. A doctor says that give a patient 270 milligrams of cefuroxime, and then he says give it to the patient maybe daily, 3 times daily or something like that. You have to first divide. So 270 divided by the quantity available, 750, times the whole medication. When you draw it from here to here, it's 10 mils. So you divide and then you multiply. So 270 divided by 750 times 10. The answer you are getting is your medication I'm going to give to the patient. That is how we calculate it. Example, we have a medication like X-Pen. That is the penicillin. Penicillin like this, it is just the powder inside. This medication like this doesn't have any water for you to dilute with it, unless you take the normal saline to dilute it with it, or a sterile water to dilute it with it. But a medication like this one has its own water for you to add. So it makes it very easier for you to calculate. But with this type of medications, they do not have any other water for you to add. So you have to sit down and then know how to add the water to it. If it is 600 like this, without any water, you just add 6 mils of water to the medication. And then when you drop the whole medication from here to here, it will be 6 mils for you to calculate easier. If the medication is written 500 without any sterile water, you just add 5 mils to the powder. And when you add the 5 mils to the powder, it simply means the whole medication has become 500 milligrams. Somebody will say, so if the powder is 500 and then you add 5 mils to it, wouldn't it become 550? No. The powder you are seeing, if you add the water to the powder, it still becomes the normal medication. If let's say the medication already being diluted, let's say you go and buy a syrup and then the water is already in, the manufacturer says it is 500 mils. You can't say anything about it because the medication has already been diluted. But with this one, the powder plus the water will still make it 500. So that is how it is. So with the 500 like that, for you to calculate easier, you mix it with 5 mils of water to that medication. If the medication already has their own water for injection, that one you calculate according to what the manufacturer wrote. But if there's no water in it, just add 6 mils. If it is 500, just add 5 mils so that it'll be easier for you to calculate. So another medication is gentamicin. Gentamicin is 80 milligrams. The whole medication is 80 milligrams. But when you transfer it to a syringe, it's just 2 mils. When you are calculating such a medication and then you are asked to go and give that medication to a patient, the same formula. If let's say the doctor says give 20 mils of gentamicin to the child, just divide 20 divided by 80. The whole medication is 80 times the 2 mils. It is written boldly on the medication that it is 80 milligrams, and when you transfer it from the 80 milligrams to the syringe, it is 2 mils. That's how you get. That is what you are giving to the child. That is it. Some people decide to dilute gentamicin. Others decide not to dilute gentamicin. Others decide to dilute it because they are saying that the medication is quite painful when you are giving to the patient. Others still decide that no, it is not necessary for you to dilute it. So dilution means that you are adding water to something. Gentamicin like this. People decide that okay, since the medication is 80 milligram, I'll just add 8 mils of water to it. It is 20 divided by 80 times 10 mils. Then you administer. A doctor can prescribe that, okay, give the child 17, give the child 20, give the child 30. The one the doctor gives you, you divide by the whole medication times the quantity. Now, when the medication is in 1 gram, 1 gram simply means it is 1,000 milligram. Always convert 1 gram to 1,000 milligram. So if it is 2 grams, 2,000 milligram, 4 grams, 4,000 milligram. Some medications, you don't have to even calculate anything. The medication is already like that. There's no need for you to calculate anything. A medication like omeprazole, if you are being asked to go and administer omeprazole, one omeprazole is 40 milligram. So the moment you just give the patient 40 or 80, that one you know that you're giving 2, you're giving 1. With the headaches, some of them you have to calculate paracetamol before you give it to them. You have to convert the 1 gram to milligram. So it will be 300 divided by 1,000 milligram times. It is written on the IV medication that it is 100 mils. So if you pour all the 1,000 milligram into a syringe, it will be 100 of the mil. This one is 10 mils. So if you want to convert a paracetamol into the syringes, you need 10 times of this syringe before you know that you have poured all the medication in the paracetamol bottle inside this syringe. So the paracetamol, the manufacturer has already written on it that it is 100 mils. 10 times of this is the whole medication. So the whole medication is 1 gram. You have to convert it to milligram. And as I said, 1 gram is 1,000 milligram. So if the doctor says give 300 milligram to a child, it simply means 300 divided by 1,000 milligram times 100 mils. The answer you get is what you are giving to the child. And please do well to write the answers you will get in the comment section so that I know that we are all on the right. I won't give you all the answers on the screen, but do well to comment the answers you get in the comment section for me to know that you are understanding every single thing I'm teaching you. How to label the medications. Whenever, let's say, you dilute it like this, if you're going to keep it inside the fridge, how do you label it for the nurse who is around to know how to give to the patient if you are gone? Because at times, whenever we mix medications, people don't label it well. They don't label the medication well. And if you're coming for afternoon shift or night shift, you wouldn't be able to even give that medication to a patient. And note that these types of medications, the ones we mix, its time is up to 24 hours. The moment you mix that medication, let's say you mix it 6 o'clock in the morning, the next day 6 o'clock in the morning, the medication has expired. We don't give it for 48 hours. No. If it hasn't been mixed, that one you just look at it on the manufacturer's order. The moment you add water to it, you mix it, you place it in the fridge, the elapsing time is just 24 hours. You do not go beyond 24 hours. It has spoiled. So in case, let's say, a patient gives you that type of medication, you mix it, but you don't label it well. The person who comes for afternoon shift or night shift will not use your medication. The person will go and take a new one from the patient again. And then by so doing, when the patient will be buying medication, because you didn't label it well. So, okay, let me teach you how to label a medication after you are done serving it. First of all, you write the patient's name on a plaster. You write the medication itself. If it is IV Pmol, if it is IV cefurozine, you write IV cefurozine. If it is gentamicin, you write undiluted gentamicin. If you have added water to the gentamicin, you write diluted gentamicin. So it's makes the person know that okay, this medication has been diluted, this medication hasn't been diluted. For a medication like those cefuroxime and also amoxiclav, those ones they do not have water. Some of them do not have water, so you have to add water to it. So with that one, there's no need for you to go and write diluted and undiluted. But with the gentamicin, it was already mixed. The manufacturer has already mixed it. So the moment you are adding another water to it, you are diluting it. I hope you are getting the difference. So with the labeling, you write the patient's name. After writing the patient's name, you write the medication name, and then you write the date you did it. If you did it on the 6th of March, 7th of March, 3rd of March, you write 3rd March 2026. And then you also write the time you did it. If it is 6 o'clock, you write the 6 o'clock. The crucial part which makes us reject some of the medications is that nurse mixes it, or the person who missed this medication, for instance, the person doesn't write. Let's say the doctor says he needs 65 milligram. You calculated it all right, but you didn't state it on the labeling. So 65 milligram equals to what? That is what makes us reject a medication. If I write on it that Mavis Akest, gentamicin, I did it on the 3rd March 2026. I did it at 6 o'clock p.m. By the doctor's request, 65 milligram equal to the answer I had. That is what I would write, equal to the answer I had. When I pick the medication, I know that okay, it simply means that what the doctor is saying, the doctor says we should give, already done the calculation already. I just take it and then administer. It helps the next person to know what to do next. The next person wouldn't come and calculate again. But if you don't label it well, I wouldn't know how you mixed it, and I wouldn't know how to administer. So I wouldn't administer that medication to the patient. But if you let me know that, okay, 65 equal to maybe 0.5, 65 equal to maybe 2.5, 300 milligram equal to 3 mils, I would understand what you are talking about. I will know that, okay, what the doctor says you are giving 300. Okay, so I'm going to give 3 mils from the medication to the patient. It makes calculation, or it makes the work very easier. So that is how to label a medication. Yeah. So if this video has helped you, don't forget to like, comment, and also subscribe to my YouTube channel. And now onwards, I'll be adding educational content like this to my channel as well. So do well to like, comment, and also follow me for more, and subscribe to my YouTube channel as well, and also join my Telegram page as well. And I'll see you in my next episode. Bye bye.